Good evening, everybody. Thank you for joining our webinar this afternoon. The webinar today is going to be moderated by Steve Zopp. Steve Zopp is the Director of Regulatory and Clinical Affairs for Artosa Incorporated. So I will hand this over to Steve and he will begin the presentation. Thank you, Steve.
So I'm going to begin to talk about NanoBone. NanoBone is a bone graft substitute cleared for use as a bone void filler for the spine, pelvis, and extremities. What it is, it consists of nanocrystalline hydroxyapatite in an amorphous silica gel matrix. Now these nanocrystalline HA particles are, again, they're very small, nanometer size, 50 nanometers in diameter, maybe 4 millimeters thick. They're enclosed in the amorphous silica gel matrix, and that is in turn very porous, about 60% porosity, over 60% porosity. So it gives you a surface area of about 200 square meters per gram, and that is almost approximately equal to the size of a tennis court. So what happens is that autologous proteins, or the things that stimulate bone growth, absorb rapidly to the surface, and that matrix also releases silicon dioxide and silicate. And if you know, silicate is very good at attracting various cells, growth factors, cytokines, and things like that that help bone form. What we found is by 10 to 14 days post-implantation, the matrix is then replaced by an autologous extracellular matrix. And we've actually took a look at that matrix because in Europe this was used a lot for dental implants, so it was easy to take biopsies, and what they found was a variety of things: glycines and glycoproteins, which there are many different ones, but we were able to stain just for the general class. BMP2, osteocalcin, which is a hormone that regulates bone growth, and osteopontin. And what we found is, there's 8 steps to the bone formation cascade. And normally steps 1 through 4, protein adhesion, cellular attachment, proliferation and differentiation, and the formation of an extracellular matrix can take as long as 30 days. We actually got through those first 4 steps in 14 days. So we do expect to see accelerated bone growth, and we will be engaging in several clinical studies to actually document that. We also took a look at ectopic implantation, that's placing NanoBone into muscle tissue and fat tissue where you would not expect bone to grow. We did it in a higher animal, in a sheep, and we found after 26 weeks, the NanoBone granules were covered basically with bone. And this demonstrates that this particular formulation, where you have unsintered hydroxyapatite, particles, with that amorphous silica gel matrix, can actually accelerate bone growth. At this point, I think I would like to, and I could answer questions at the end. I'd like to introduce Dr. Howard Rosenthal. He is the Associate Professor of Orthopedic Surgery at the University of Kansas Medical Center. His specialty is musculoskeletal oncology and sarcology.